and showing your confidence regarding the device. So just for understanding for other dentists also, or other senior surgeons, how you get motivated to use this magnetic mallet?
I got exposed to this device when it had come to me about 2.5 years back. I did a very difficult case where there was very less bone. There was almost 2 mm thickness of bone. Where there were any device or any kind of technique to do an implant on 2 mm thickness bone is difficult because the first drill which we place is 2 mm drill. And if you put a 2 mm drill in a 2 mm bone, this is definitely going to destroy a hole. The only place where we can expand this bone or use an implant in such a bone are osteotomes. If you have an osteotome which is mechanized, something like magnetic mallet, you can have the control as well as you can split the bone in the way you want. And that is what motivated me to do for magnetic mallet.
Okay, thank you, sir, for sharing this. And second question, as you are using this device almost more than 2.5 years, so as you started at initial phase and now after using this device 2.5 years, what have changed during this period and how the buzz, the tips that we are providing, how it's working?
Actually, the tips, if you use it properly, I think I must have done more than 100 cases with magnetic mallet. But the tips are workhorses, so they don't get damaged. That's the major advantage. For the simple reason because there is no wear and tear. So like any kind of drill, when you apply it in rotation, there has to be some wear and tear. But here there is no wear and tear. That's the magic of magnetic mallet. One thing. Second thing is it has changed my practice for maxillary. Right now I don't use any kind of drills.
Oh, great.
So it's a very good combination. If you have an active implant with magnetic mallet, you just don't need to use any kind of drill. The only if you are using a passive implant, you may need to have after you do the expansion with magnetic mallet, you may use the last drill just to have the proper assembly for a passive implant. Okay. Otherwise, for maxillaries, I just don't use any drills or any services.
Great to hear, sir. And sir, one more point I would like to ask from you. As you started the magnetic mallet, as you said correctly, that now you are using maxillary implant or most use magnetic mallet. But before that, when you were not using this device, so how the patients, as a patient's perspective, what has changed? It's pain less or something like?
See, magnetic mallet is a non-traumatic way of preparing the implant site. Okay. So what it does is basically because they are osteotomes, it is going to displace the bone. That is the major advantage because you are not traumatizing the bone. There is no heating of bone. Okay, it is just creating way so that you have that proper osteotomy with the help of expansion. Okay, that's what it's going to do. And maxillary bone is normally a soft bone. It's T3, T4 bone. So it's a perfect way of preparing implant site for implant placement.
Good. And sir, one more thing. What is the last message that you want to give to your colleagues, seniors or juniors regarding the magnetic mallet? What are the key points that you want to mention?
If you care about your patient, if you want your patient to have a painless, no swelling, very fast healing in their implant sites, magnetic mallet is the way to go.
Thank you. Thank you, sir, for showing your update on it. Thank you.